Hey everybody, John Malanka with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA certified organic hemp and CBD brands, and all of its hemp is grown from the perfect topography and climate found in Colorado. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. And we are live. Paul Bregman, Dr. Paul Bregman, good to have you here as always, my friend. How are you doing?
Good to be here. Thank you.
Good to see you. So let me see here. You and I have been friends for quite some time. We did a podcast that went live last week, and it was you sharing what it's like to go through life with a disorder. And your disorder has been depression, bipolar. And thanks for sharing, because that has opened up a lot of doors for a lot of patients have called and said, that's what I've been feeling. And so I applaud you for that. And a lot of people wrote in and said, that was really brave of him. Beth Dost, who is a nurse that works with us, she said, God, that was one of the, and she edits a lot of these videos. And she said, that was one of the most informative and heartwarming interviews that you've had, John. So thanks for being part of that, Paul, and trusting me with your story. So you want to share a little background on what you do and how you got into the cannabis industry?
Yes. So my name is Paul Bregman, and I'm originally from the East Coast. I'm living in Denver for the last 30 years. My background is I was a trained radiologist, a diagnostic radiologist here in Denver for a number of years, and also in Portland, Oregon. And then I was had a retired disabled at age 45 with a diagnosis of bipolar type 2, more depression and irritability, and we'll get back to that. So I retired disabled, and for 10 years I did mental health advocacy work. And then in 2007, I started doing medical cannabis evaluations because I'm based in Denver, Colorado. So I was doing that for a number of years, and I've been in the space since 2007. I testified with another doctor to help make sensible, good sense out of medical cannabis here in Colorado. That was in 2010, 2011. But me exposed to cannabis was later in life, in 2005, when I was 45 years old. I had done a little bit of cannabis in medical school in my 30s, but nothing much. And cannabis entered into my medical world is because my bipolar, mostly depression, some irritability. Bipolar 2 is depression and irritability. Bipolar 1 and hypomania. Bipolar 1 is what people thought of as manic depression. Really, your manic episodes when you're really speeding along and you're not getting any sleep and you're hypersexual and you're just really 2, 3, 4 days on end. You could be psychotic at some point. And then you'll go into a depressive period as well. And so it's these highs and these lows. For me, it's climbing up maybe a quarter of the mountain or half a mountain for the hypomania. And then the low for me is very, very low, suicidal ideation low, mixed with irritability, just like my father and just like my grandfather. So with one parent, you have a 35% of developing a mental illness.
Yeah.
When I talk about serious mental illness, I'm talking about bipolar, depression, forms of anxiety, OCD. One of the most prominent is schizophrenia, that we'll talk about, because if you're using cannabis with schizophrenia and you're not under the supervision of someone, you could have, it's very dangerous in that situation, almost contraindicated.
Yeah.
Except for very few and whatever, probably contraindicated. So the effect for me was having the diagnosis and it being treatment resistant. I went to a psychiatrist, went to a doctor to make sure everything else was okay. And then I went to a psychiatrist, and here I was at the top of my game as a radiologist, but I was suffering inside. I would make it look good and be able to function. So he would diagnose me with bipolar, and he gave me all different sorts of medicines, and nothing worked. So ultimately, I was treatment resistant to the medicines that they were giving me.
You know, we did the podcast that we aired last week, and the response from our listeners was humbling, because people just said, "Gosh, thank you," because I didn't know what I was experiencing, and you know, to know that I wasn't alone was a common response that we had from people. And so this is exactly what happened to you. You're 70 right now. You were diagnosed, clinically diagnosed, right in your 40s, early 40s, like 41, was it?
Yeah, 41.
41, but you knew something was going on earlier in your 20s.
Yes, the trigger, there's always a trigger. My illness is bipolar type 2, like my father and like my grandfather. I'm bipolar type 1 and to bipolar type 2. This is a mood disorder. So the other things, bipolar type 1 is real manic depression, where people have high episodes of being very high and speedy, eating, hyposexual, just everything is fast. And then they also come down into periods of depression. That's bipolar 1. Bipolar 2 is some upward slope of energizing, but mostly depression and irritability. And that's what I had, and was diagnosed at 41. But I really felt my mood starting to change at 29 when I started my radiology residency, and was started to doing multitasking. Before that, everything was organized. But for a bipolar person who likes structure, like myself,
Yeah.
it started to, but I made it look good for 10 years. Even though I was really hurting inside, I had the perseverance to make it look good for many years, for a number of years, until I was diagnosed. Because I was a radiologist, and I had risen to chief of breast imaging at Denver General Hospital. And so until I was diagnosed and started to get treated by a psychiatrist just by chance, whom I met, I didn't go to a psychiatrist saying I felt depressed. I just met him. And then I explained to him my story and my family history. And he said, "It sounds like you have bipolar." And at 41, after suffering since 29,
Wow.
I started to see a psychiatrist. And that's when we started the medication. And you go to a psychiatrist, you're going to be put on medication. And we can address that issue as well. And so, but none of the medicine worked. And I fell into a category of treatment resistant bipolar or depression. And it was just, it's already being depressed. And if you're not managed well with any of the medicine that they have out there, with all the cocktails they're giving you, and it wasn't like I suffered bad side effects from the medicines they gave me. It was a matter where they just didn't work, either alone or in combination.
Let's back up here too, and I know we had a little glitch, and so you were already on the story about hereditary. You know, your grandfather went through depression.
I didn't know my grandfather. This was my father's father,
Hmm.
but what my father tells me of him, he was having manic episodes, from what his behavior.
Yeah.
And then when having my father there, he didn't go to a psychiatrist, but he exhibited irritability, extreme, and I don't think that much depression.
Yeah.
And so I have deeper depression. I can function, I try. But I had a retired disabled because I was so depressed. I certainly have some irritability at times. And I have some hypomania.
No, you're a New Yorker. That's why.
And part of it is being a New Yorker as well. So you get into this double whammy, Aries, New Yorker, and then having this illness. So it was bipolar type 2. And we tried all this type of medicine, and there were some minimal side effects and stuff, but I was just frustrated that nothing was working. And even before I had even addressed started using cannabis, which I hadn't really until 2005. So diagnosed in 91, didn't use cannabis for any mood relief until 2005. I was receiving electroshock therapy every November or December or January when the days got shorter to lift my depression. 13 treatments, outpatient, very benign procedure. The worst, and it brought me out of my depression. I mean, the side effect of electroshock therapy is the fact that you can lose good portions of your memory.
Can you talk about that? Because that was one of the number one write-ins that we had about electric shock therapy. And that
electroshock therapy, they have a number of different things now. Electroshock therapy has been around for a very long time. It works because they think it resets the thermostat or in your brain for the neurotransmitters, dopamine, serotonin, norepinephrine. It resets that, all right? It may last 6 months, 7 months, 8 months. It's a very benign procedure, outpatient procedure. They medicate you, they put you out for 20 minutes, 30 minutes. They attach electrodes to the side of your head, you're out. They induce a convulsion and you're wheeled out and you wake up and you leave the hospital 2 hours later, you have a bad headache. And then, so they have a protocol. For me, it was 3 times a week for the first 2 weeks, 2 times a week for the next 2 weeks, 1 time a week for 3 weeks. And after this second, or after the 5th treatment or the 8th treatment, my mood started to get better. And it was really good. I had some problems with it because one of the times they really scared me by, it was 1 in a million type of case. But that's, electroshock therapy should only be used when all else fails. You know, that type, you've gone through the medicine, you've tried different things, and here you have but it works in 80 to 90% of the time with depression and also mania. So the good thing is you're almost positively that it's going to work and you have something there for you at a regular basis. For me, it was during the short periods of when the days got shorter. That's when the depression. Now they can do it at different intervals.
Well, now I mean, I think a lot of people get that. I lived in Belgium and it was dark, you know, in the wintertime.
Oh, seasonal.
4 in the afternoon, and it would be dark at 9 in the morning still. And
seasonal affective disorder.
Yeah.
So it made my illness worse. And so electroshock therapy was a lifesaver until I found, moved on to cannabis and still some Western medicine. I take some psychiatric medicine as well. But electroshock therapy should not be ruled out by any means just because of One Flew Over the Cuckoo's.
I was going to say, many of the images
it's got the worst.
Is One Flew Over the Cuckoo's Nest.
So that's advice that I would give to someone is you try the different medicines, you do everything, and don't be afraid to take the step to electroshock therapy.
So moving away from electric shock therapy, cannabis was not, I mean, you were in college and I know we talked about that. You use cannabis in college, like many of us.
No, not that much, hardly at all.
Really?
I used it in medical school a little bit, didn't use it in college, didn't use it in high school, and really didn't get into it that much at all. And then here I was, I retired in 1995. I was being treated with electroshock in the winter, and I was being treated with other medication that wasn't work. I finally read an article in 2005 now, and that's when I had been married already and had a 4-year-old, a 4-year-old, and a 1-year-old. And I read an article about cannabis and depression, and I bought some flour. It still wasn't legal here yet, where they had dispensaries and stuff. And I went out to the garage with a glass pipe, and I took a couple of puffs. That's all. And I came into the house, and I was a different man. I was a little high, but the idea is the irritability evaporated away, the depression evaporated away, and I could be present with my young children. 1 and 4, and it was difficult. I was married to the wrong woman, when we
Well, I
got
was going to
married,
ask you if you
but
had support.
it was just the wrong person, given
Yeah.
everything, even the background, even if I was in the normal of times, but she turned out, and I wanted to clarify this, she's a wonderful mother of my children. I mean, my kids are 16 and 19, and I'm 70 and she's 53, but she's a wonderful mother. We just weren't a good couple together. We couldn't make it, and we tried. But the idea was, and I was different. It's very difficult to be married to someone who's got a major mental illness. And a lot of people with mental illness say, I refuse therapy, I refuse medication. They don't want to do any of that stuff, or they want to self-medicate. I was in line just the opposite. I was going to therapy twice a week. I was trying all the different medicines they were giving me. I was doing whatever I needed to do in the midst of turning my life completely upside down. You have to understand, I had to retire disabled because I was so depressed that I had to walk away from all those years of training and all the things that I was good at as well. And I didn't know who I was. I lost my identity. Not only losing your identity, but I didn't know who that person. I knew I was depressed, let me tell you. And it was such agony of trying to get up and to move and to do and things like that. That's what mental illness is all about, the difficulty that people experience, whether it be bipolar or PTSD or anxiety or OCD or schizophrenia or any of this along the way. It's managing your mood or whatever's going on with you and having the support there. And hopefully you can find some good medication that will help you regulate, what you're doing while you take care of your diet and your sleep, and you have support and you have a partner. I've been alone for a very long time as well. So let's just go. So 2005, I started using it and incorporating it into my life. And it basically changed. It took me a long time to tell my psychiatrist because I was afraid of what he'd think. And then I told him, and he said, I'm glad you're getting some relief. We have nothing more to do for you, basically. And so that was the beginning of the odyssey into the cannabis world while I was still taking some other psychiatric medicine and seeing the psychiatrist. And then I also saw a cannabis expert along the way, to help me as well.
Yeah. Did this happen? So you've already left your profession as being a radiologist?
Yeah, I left the radiology profession in 1995. And this
2005.
cannabis introduction happened in 2005.
Yeah.
10 years.
Yeah. So you mentioned support, and that's so important. And I know in our podcast we spoke about this and the support, but not only losing your identity as a doctor, a practicing MD, but also a lot of your colleagues kind of, I don't want to say turn their back on you, but everyone, I don't know if it's just life, people get busy and they just move on. And
that's one thing, John. The other thing is that there's a stigma about mentally ill people.
Yeah.
The idea is that people, if I tell you I'm on bipolar, that you may see me as bipolar before you see me as a person.
Yeah.
So my actions may be interpreted as being bipolar because of what you're thinking. So they don't know that a phone call just to say 2 minutes, just to say, hey, we miss you here at the hospital. I hope you're doing okay. Hang in there. It must be hard. They don't know. Most people don't know how to do that. It's easier for them to extend themselves for cancer or heart disease or something like that, as it is to say, man, this guy has a mental illness. And last week, he was just walking around the halls with me and talking to me. Now he's gone and he must be crazy.
One flew of the cuckoo's nest. That's we talked about that in our podcast as well. I'm reading some questions here. We've asked, so a question came in, overall description of bipolar. So you kind of touched up on that. What's it like to live with bipolar? And then when it's present, what is usual for age and behavior is another one that came in here. And I mean,
What was the last one? When does it present?
when is it, when it presents, what is usual age and behavior?
Okay, a lot of mental illness and bipolar and depression can present, meaning 40, 50, 30, 40, 50% can present before the age of 20.
So are your children, are they on that road like you followed your grandfather and father?
No, fortunately, and in my own family, I have an older sister and it hasn't affected her at
Good.
all. So I'm affected. My father was affected. My mother had something. I don't know the exact diagnosis, but my father was really the blatant one with regards to that and did the best he could.
Yeah.
My kids are 15, 16 and 19, and they haven't shown any characteristics
Good.
yet. So,
Good.
but we're keeping close eye on them. Remember, mine didn't show up until I was 29. I was a superstar kid, high school, everything, and nothing. It was the break in the structure and the routine. And plus, because most of the time, this major mental illnesses will come out 20, 21, 22, 25, something like that. Mine happened at 29, but I didn't know what was really happening.
So is this something you've had discussions with your children about? Do they know what's happened?
Well, yeah, they do know what's going on.
Uh-huh.
They knew, they sensed something was going on a while ago when they were young. And then I got divorced when the kids were 3 and 6 because, when I speak to the kids now, they never really understood, apart from the bipolar, they never really understood why the two of us ever were married, even at a very young age. You know what I mean? The bipolar issue was something that I slowly introduced to them when they could understand it. 6, 7, 8. I wouldn't get into the details, but I would say that your father has an illness. And I would discuss it with them as best as I could. And then as they got older, but the problem with the mental illness too, even in my marriage and even with my kids, is I look good at time, most of the time, but their expectations versus my limitations rub against each other. So my girl, as a teenage girl, at times had a hard time understanding that I couldn't do certain things because my mood was so down, which is normal. She's a teenager, I don't expect her yet.
Yeah.
My boy, I think, has a better understanding. But a lot of people don't have any understanding about what we're talking about here. I don't think it's not pointing fingers. It's just for people to really grasp the depths of what I'm talking about. And on top of what I'm talking about, my depression, there are different forms of depression, or two types. My depression was with suicidal thoughts, not actions, and that depression with no suicidal thinking. You don't even go there.
Yeah.
So I had to contend. There's a lot that I've had to contend with in this realm of mental illness, of trying to figure out the best regimen for me. I'm a survivor, really. I mean, this type of thing. And cannabis, the THC in the cannabis, the CBD calms me down somewhat to a degree, but it's really the THC that lifts my mood, not dabbing or anything like that.
Yeah.
Smoking of the flower, 1 or 2 puffs, lifts my mood to be able to be productive and to be more feeling normal as opposed to really feeling high. It's not so much that I feel high. It's just that when I spoke to the psychiatrist, he said, this is what an antidepressant is supposed to do for you.
So let's talk about cannabis and antidepressants. So I'm a big fan of having a medical expert involved, and I think you'll mirror me on that as well, especially if other antidepressants are involved with that. Can you talk about drug-to-drug interactions and what you would recommend? Because I know you still see, I guess, do consultations, and I'll.
I do information and resource. I connect people with other people who are really practicing experts. To cannabisresource.info, my website. And the idea is that what I see in this aspect is the fact that it's still it's the newest subspecialty. And for people need the right product, but more importantly, as well as that, they also need the right dosing or titration, as Dr. Uma likes to say. The titration, if you don't have it, and there are only a few cannabis experts in the country, maybe 20, who really know what to do. The dispensary people know nothing, 99.9%. They're not doctors. I don't know pharmacists. A lot of people weren't trained in it. So they're only about 15 or 20. And by going to them, you can get a treatment, like you go to the GI guide for your colon. Here, this is going to a cannabis expert to set up the treatment regimen and to also do the follow-up.
So earlier you talked about going into the garage and grabbing your glass pipe, and I think people have that visual going in. Can you share what that was like and what you're doing today? I know because other conversations we've spoken on this topic, you've talked about CBD and you've talked about THC. I know other patients that are going through bipolar disorder, and they're finding success with high doses of THC, while others are finding success with high doses of CBD. And so why is that? How is that working? Because I know it's not a one size fits all. Can you share?
There's an umbrella where people should start with low dosing and then move under their expertise of how they're going to, whether it's going to be 1-to-1 CBD to THC or whatever. And then they're going to have to find what works for them. If they don't, at least get to a consultant to really tell them this is where to begin. So my journey is mostly involved THC, and I don't use edibles or tinctures because it doesn't get in fast enough, and the edibles don't get, I'm missing a certain enzyme in my liver to metabolize edibles. So the only way that works for me is inhaling. So I have either a vaporizer like a Volcano or something like that, PAX or a glass pipe, quick. I'm not using much, and I'm not really even getting, really high, but just lifting my mood. So the idea is, and then I balance off the THC with the CBD because of its anti-anxiety effect. So I take that. It doesn't work as well for me. I don't smoke it, but I do take a tincture, or, I'm doing some work for a company now that's a startup, Good for Topa, concentrating on topicals and stuff. But the idea is that I think CBD is there for, and some people treat their depression with CBD. And some people treat, they're not all over the map with it, but there is a certain regimen. But I think there's a mix of THC and CBD. And you rely more heavily on THC, not dabbing, but just flower, sativa flower, if you want to call it. I think everything is mixed up anyway with genetics. So for me, flower, and that's what keeps me really going. And then also CBD.
And do you start your day? Is this what you start your day with? And are you continuing through the day to keep your body balanced, or how does that work? Or
Yes.
Here,
so the morning may be very little, or just very little. It just would be like taking an antidepressant pill, I would imagine, for others from what they describe, and the CBD, a few drops as well. And then I may do that another 4 hours later. And then another, maybe do that 3 times a day. And tonight, I would like to, sometimes I use some CBN if I can get my hands on it, and see how sleep goes. But Western medicine that I've been taking for a long time, a mood stabilizer called Depakote, extended release. I do at times take Valium as a tranquilizer. I've been taking something, temazepam, for sleep. I don't know if it works anymore, but I've been taking it for 25 years and didn't want to upset things. I didn't find that I just kept it in, so I added CBD onto it. And then the other major portion is the cannabis. I don't know how.
When you don't have sleep, is it kind of a domino effect the next day of how your body reacts or how your body's feeling that day?
Not as much.
Mm.
I'm tired, but
Yeah.
the cannabis helps me move forward into the day and then get what I need to get done. And if I need to take a nap, I will. But I think sleep is very important to the whole aspect as well. I mean, the major things is you have to find what medicines to take. You have to make sure that other things are not going on in your body, like thyroid, etc. You have to have the right diet, exercise, support system, and psychiatrists or therapists, psychologists, someone,
A team.
social worker, but therapy is involved. Somebody to handle your money if you can't control your money. And if we could talk on that, that's one of the biggest points of this whole thing.
So let's talk about behaviors, because I know you kind of mentioned at the beginning some people have messy behavior, sexual behavior, and money behaviors of spending.
No question about it. There's no question about it. I came from a home where other homes during that generation, money was love.
Yeah.
Expressed by my dad in that way. So I never learned the value of a dollar. Okay. He was a good saver. If you don't know the value of a dollar and you're already bipolar and you're already kind of revved up in that way, there are people that have money problems that don't have bipolar. Don't get me wrong. But if you're some of those people may be starting out at a level 3. If you're bipolar and you have money and you don't know the value of what the dollar, you're starting out at a level 7 and you can go through money and not even know what's going on and make bad choices, make bad investments, do things. That's why if I had to do it all over again, I'd get the disability money that I had coming in,
Yeah.
as well as all the money that I ever had, and let somebody else do it and put me on a budget and save for retirement in that way. But see, the problem is that when you go to the therapist, I'm a doctor, I was going to a very good therapist. It was a matter where that portion of my life, these other portions of my life were not addressed. I think the therapist should have said, he knew what background I was in, and it would have been nice for him to say, we got to get the money out of your hand. If I do anything else for you, at least you're 45 now, at least you're 65, you'll have at least maybe a couple $1 million saved up, or $1 million saved up if we put it in the right hand, because you don't know what the fuck you're doing with your money. And that would have been whether I had bipolar or not. Having bipolar just made it worse. And so these are choices. Money's a choice, is the choice. Who you marry winds up being a choice. Why you're getting married, what are you doing, who the person is. Mine was a loving marriage as best I could, but it also was, I needed an anchor. I was afraid. I was depressed. Excuse me.
Do you still see a therapist now?
Yeah. Therapy, talk therapy to me is the most powerful tool there is, besides the cannabis. Besides those two, that combination for me. If I can talk to somebody on a regular basis and cry on a regular basis, and talk about my kids, I have a lot of remorse, because remember, having kids under normal circumstances is hard. You know what I mean? And just being a couple. I didn't have my first child until I was 51. All right. And the idea was that I was diagnosed with bipolar at 45. So I was still very sick. And it was just very difficult to be having an uncontrolled mood disorder and be the father of young kids. And so I feel most regret about.
Well, there's no better time than now, the present, to be a great dad. I know that.
I am. I mean,
I know you are. I know you are. But
right. But it's something to really want years back.
Yeah.
You know what I mean? To sit and read with them, to sit and, I wasn't a screamer. There wasn't yelling in the house or anything like that. It was just feeling of trying to move forward. So yeah, I have a very good relationship with my kids. I text them all the day, each day. I'm not on their case. I'm not a helicopter, but I'm certainly a person who now could really tell them how much I love them.
Good. Good. And do they know? I know we talked about this, but I think for our listeners that didn't watch the podcast, um, cannabis use. I know they're in high school, and I know they can Google. Do they know they? Do they? Did the podcast come up in family discussion last week?
No, we've never actually had the discussion. They've never asked me to discuss. They know I'm in the business, and they
Yeah.
know that I've done a lot of good work in the business,
Yeah.
et cetera. But they've never asked me if I used it myself. I'm sure they've Googled and read my story. We just, plus for your audience, I lost my medical license because I had a legal medical cannabis card in Colorado. And so you couldn't have both. You couldn't be doing cannabis legally as well as doing evaluations and practicing medicine. So they make the assumption that you're high automatically by just having the card, even though my psychiatrist recommended that I could use this medicine. But the idea is, so I haven't had that talk with them. They've read, they haven't asked me directly. We've spoken about cannabis, and I've told them, you're young, don't do it, whatever, what the story is. If you have any questions, and I'm almost sure they know where I am, but they haven't. It's not like they come over here and they smell anything in my house or anything like that. But if they ask me, I would definitely tell them, and when they get older, I'll definitely tell them.
Yeah, I'm certain. Teenagers aren't dumb. Even single digits children nowadays. I mean, they're quick. They know what the internet is. And so I think probably when you do have that conversation with them, they're going to go, Dad, we've known since we were 8.
No question. Yeah, no question about it. And it's just something where I don't want to have to put them in the spot of knowing, so that if it ever got out to their friends, or something like that, who, let it be from some other source and stuff like that.
Yeah.
But they know that I go through therapy. They know that I take medicine. They know that I have a mental illness, and know that I'm trying the best that I can do. And that's been presented to them through the years. That hasn't been hidden.
Let me read a couple of questions here that have been. This is from Christine, and Christine saying, "Dear Dr. Bregman, I'm wondering if I'm genetically not compatible with cannabis. My background is that I have 2 haplogroups, which is Scandinavian and Sami, Saami. Sorry, Christine, if I don't know that nationality, I guess you want to say it. A little over a year ago, October 2019, I bought some 50 milligram capsules of CBD isolate and full spectrum hemp oil. At first, it was calming for a few to 2 hours, but then it wore off, and I was left feeling vaguely unwell. I was soon taking 4 a day just to keep from feeling unwell. Close to running out, I tried to buy more, but Nevada's rules have changed, and they were not allowing anyone to sell any more oral CBD. I weaned off and avoided taking any more until about a month ago. A company offered the combination of 2 bottles of tinctures, 1-to-1 CBG to CBD, as well as a 1-to-3 CBN to CBD. I've tried taking various amounts of both. Neither have been calming or aid to sleep. Am I likely genetically not compatible with the cannabis plant? With those kinds of experiences, there's no way the 71-year-old woman, your age, would be interested in trying anything with THC. Thank you for this opportunity to ask this question, Christine. And so thank you for Christine for that question, detailed question.
My answer is this, that I'm not speaking to you as a physician in prescribing or dosing or anything like that. This is the advice. This is what I do for a living now, where people call me and I give them advice, education, as well as I direct them to the best docs who can help. This is a woman in Nevada, or she needs to contact you. You do this, I do this. She needs a cannabis consult to really figure out what's going on with her. And this is where experts intervene. They do a history and physical just like any other subspecialty with her, whether it be Zoom right now, and they'll ask pertinent questions, and she'll get off that call, not only having established a relationship with the cannabis doctor, but she'll know which medicine to buy, depending on what state she's in, and then how much of the dosing she needs to take. So all of her questions can be answered.
Yeah.
Right now, she's getting, I don't know what product she's buying. There's 3,000 brands of CBD out there now that I learned today. 3,000. That came from a source at Charlotte's Web. So there's a lot of junk. 99% of it is junk.
Yeah.
And the idea is, without knowing what you're taking and what's tested and what dosing, any THC, any CBD, in the hands of an expert who's seen your case before, probably, that's what you need at this point in time.
Yeah.
Nothing is off the table.
So like you here at United Patient Group, we do have consultants that do consultations with the family members, as well as the doctors if they want to join in. And I think it's nice to have everybody on the same page, coming up with because again, it's not, I'm a broken record when I say this, not a one size fits all. You look at age, weight, current health condition, any medications you're on, sensitivities, times of days. And like you said, doctors, not too many doctors in this industry, unfortunately, know about dosing. I mean, I still hear family members and patients say, I received this recommendation and my doctor says, yeah, call me in a year if you want a renewal. And that's frustrating because a lot of people that come to us, United Patient Group, many times they're cannabis naive. They've been diagnosed with something. Go, where do we start? A lot of times send them to you. This is something that you've worked with before. You and I've.
Or you send them me, or you have doctors. I'm the same sort of resource.
Yeah.
Like you with regards to that. I get them to the experts that they need to get, who's going to have seen the cases.
So you've had success with smoking. Others, and it sounds like Christine was taking a capsule, which you're not finding success with due to liver. With a patient,
but
like
I'm in
this,
the minority. I'm in the vast minority.
Yeah. And so, is there a chance? So let's talk about THC. I don't want people to be afraid of THC. I mean, you can have success with a 1 to 2 milligrams of THC. And I always use wine as an example. My brothers have been in the wine business for 20 something years, and it's like going wine tasting. You can have a sip of wine and you're not totally intoxicated, or you get 3 bottles of wine, you'll be intoxicated. The same thing with THC. Sometimes they do go hand in hand, and people, a lot of bipolar patients that we've worked with are seeing a combination of the two, finding success. They've had success with CBD. Adding THC can up that success. Are you seeing that, or have you ever seen that in your practice?
Well, in the practice, remember, I'm not treating anyone. So that's, I'm not seeing it. It's not a traditional practice.
Christine's fearful for taking THC,
and that would be discussed with her treating physician. Yep. The bottom line is, I'm with you. Yeah. Everything should be on the table, and you go slowly according to certain dosing and things like that. THC, you have to be very careful about. And in any of these, especially with mental illness, but in any set of circumstances. And that's what the consultant will do. If she does it on her own, she could get very much, into just, it's not going to be a good experience.
Yeah. I'm going to do a plug here. Tomorrow, so I've been working on some for the since June. And I was asked to host a summit called the Green Plant Summit. And for our listeners, there's about 30 to 33 medical experts on there and talking about different things and ailments. And it's called Green Plant Summit. You can find it at greenplantsummit.com. And I'll send you the link as well, Paul, to get in there. It's a free online course. And it, again, starts tomorrow, 9 a.m. to 9 p.m. And it will played through Sunday, the 22nd, 19th, 22nd. A lot of information there, and proud of all the people that we interviewed. I should have had you on, but we'll be doing another one because this topic comes up quite a bit of depression, anxiety, PTSD, which we covered, and bipolar. And so, and it, like you said, I don't want people to think they're alone. You're not alone, and you've shared this as well. What can you share with the family members that do not have support from their loved ones?
They need to find the numbers to call, whether it be the suicide hotline or the mental health hotline in their community, which I've done at different times. And when they're feeling low and alone and they have no one to talk to, they call these people. And nobody's going to be showing up at the door unless you say you have a gun to your head or something like that. But you can stay on the line and they'll ask you whether want a trained counselor or whatever it is, and you have someone to talk to. And that is very therapeutic to do. Or you can make a pact with one or two of your friends just to say, like I have, that if I'm really in a dark place or I'm feeling very alone, I'm going to call you up and talk. Or do you think that I can come by and maybe hang out for a couple hours or even spend the night? You have to try to get some support in any which way you can. Because the idea is what we're ultimately trying to prevent, to not only rescue and stop the suffering, which is thing, but after a while, people get very tired of the suffering and they lose hope and they're alone. And what's the next step is they commit suicide. And it's not 100 people. What is it? 100 people, more than 100 people a day commit suicide. 40,000 people a year commit suicide. A lot of that is depression, PTSD, things like that. Cannabis can at least put you in a different space. Your therapy may be better. You're feeling about it better. You want to be productive about it. I'm not saying cannabis is the be all and end all. That's why an expert, your regular psychiatrist probably isn't going to know about these things. That's why you have to use John or myself to get you to the right person. And if you think you're doing well, you probably could do better with a little, tweaking of things.
So in your personal case, how much time do you put into your health maintenance? And is it take what you're going through? Does it take a lot of effort to say, I'm going to get up? I thought about the reason I said that yesterday morning, we're here in the San Francisco Bay Area and woke up when I wanted to get a ride in, but I knew yesterday afternoon it was going to be raining and it was howling wind. The sun was out, but it was howling wind. And I said, let me just do this. And I got up, put my gloves on, my winter gear, and went for an incredible ride. And I did a video for United Patients Group, actually for tonight's show, announcing it, just a little teaser. But I got out. I can't tell you what that did to my mood. And so to take that step, I could have sat there and said, oh, it's windy out, I'm cold, let me have a cup of coffee or something like that. And anyway, I did my whole ride. I got home and I literally was putting the key in the door and I turned around, torrential downpour and rain the rest of the day. But the rest of the day, I was pumped up. My energy level was pumped up. And so that was my health maintenance.
It's one of the ingredients to a healthy mind, even if you don't have mental illness, but it doubles the importance of some form of regular exercise, the right kind of diet, the right number of sleep, okay? And what you can and can't do that's not going to cause you to stress or worsen your mood.
Are you able to get outside and get some exercise in? Are you good?
It's hard. It's very difficult.
Yeah, it's hard for everybody.
It's taken me time to, and John, I come from a state, not Colorado, but my mental state is I'm happy if I can get up sometimes by 10 o'clock in the morning and get going and sit at my computer or have a meeting. I'm grateful that I was productive for that day. And I'm on the more severe end of the spectrum. But what I said to you by getting the regular exercise and the diet and the sleep and touching base with my friends, you know, it's key. And the other ingredient is, if you're single, think of some interesting way, or don't give up from trying to partner up. It's hard enough to be alone in general unless you're, wired that way. This is a much harder road to hoe as well, because the depression. But the first thing that people have to realize is that they have to get the help that they need, and they have to bring in this as a team member of the consultant group,
Yeah.
because you have to take something to help your mind. The exercise will help, the diet will help, the peace of mind of not having to pay the bills and having somebody controlling the money will help. But ultimately, you have to, be able to incorporate these things together. And I can't understate the importance of exercise.
Yeah. Yeah. Here's a question that came in. Hi, hey, Dr. Bregman. Do patients who experience highs and lows typically experience one longer than the other? And is this a consistent problem? Also, more depression or more mania, is this consistent?
Well, if you're having this issue where you are having severe mood swings or mood swings, you need to go to the doctor and be frank about it so they can run some tests about thyroid and stuff. And then if it's out of sync, then ultimately you will need to, possibly get on some medication or figure out a different diet or exercise or try the natural things first. But it's not normal to have these prolonged downswings or these prolonged upswings or hypo area of time. I think most of the time things should be relatively level. Life goes up and down. There's no question about it. It's all to what degree is what it
What is your daily? I know you said sometimes it's hard just to get out of bed by 10, just to get up to get to your computer. What is your daily?
So life? I get up, I take the dog out with me, go for a walk earlier in the day, not a long walk, just to get out. Then I'll have a regular breakfast of fruit and Cheerios and just a hearty, good breakfast. And then I'll begin some work, and then I'll eat a light lunch of salad or something. I'll go out for another walk with the dog, make some phone calls. And then by 3-4 o'clock, I'm pretty much, done. And I'm in bed many times, 7:30, 7, 8, that much, maybe later on Friday night or Saturday night. But it's a pretty quiet time. And especially now, I think more and more people are suffering with COVID than any before, with mental illnesses. And, suicide rate is up, domestic violence rate is up. But I think anxiety and all these other things that are going on, COVID especially, I think mental illness it's having an effect on the mind.
Well, I think mental illness is, but I think COVID is, and everyone's being, cabin fever. I mean, it's, now, as I mentioned in my little snippet video leading up to this, colors they're saying, oh, the San Francisco Bay Area now has gone from, I don't even know what colors now from red to purple or purple to red. Don't have Thanksgiving. I have patients that just called today saying, we can't see our family members, which we haven't seen for months. We were looking forward to this because a lot of family members do get together. I'm not going to see, all of my aunts and uncles because they just feel it's best that we all don't get together. And, that brings a lot of, it's sadness. I was talking to my friend's wife the other day, and they live in California. Her mom lives in, the East Coast somewhere. Sorry if you're listening. And she's from Boston, actually. And her mother is going through dementia, and she hadn't seen her mom for 13 months. And, that's affecting the mom and the siblings on this side, but also.
It's an upside down. John, 20,000 people have died, and they've died alone, basically. you have X number of million people with the COVID situation, and now being socially distanced and not being able to see people.
Yeah.
The effects of that are mind blowing.
Yeah. Yeah. No, it's I hope no one's going. That happened to my brother's best friend and his parents. They were married 60 years. Dad had COVID down in the Southern California area. He had to go to the hospital. They wouldn't let any other family member there, and that's how he passed. And a lot of we had Dr. Chintu Sharma on here, medical director in Maryland, and he says a lot of times it's the nurses who are sitting by the patient. And actually, this was the case with my brother's best friend, his dad. The nurse was by there and just unfortunately having to report back, that they didn't pass alone, and that's affecting them.
That's a scar. That's a permanent scar that these people will carry around of sadness. That's a deep hole in them. And if any of them are prone to depression,
Yep.
First of all, that's situational, but
Yeah.
that can be a trigger to move people into depression. Usually there's a trigger. For me, it was starting my residency, but for other people, it can be other triggers like the death of someone, your loved one, and you weren't there.
Do a lot of doctors go through this? You're talking about starting your residency, because I've met with doctors that go through depression, working all day, coming home, maybe no one's home. They're dealing with death on a daily basis, sickness, illness. They come home, or they come home and they do have their family and they just want to relax a bit, and their family.
I think there's a lot of factors that enter into it. It's multifactorial with regards to the stress of a new job, what's going on at the job, how you're handling things emotionally, what sort of family life do you have, if you have, and that's a big thing as well. I think most residents that I've met were just tired from the hours, and also tired from the amount of information they had to take in a relatively shorter period of time. It's a grind.
Yeah.
It's a grind.
Yeah. For our listeners out there that are going through this, what can you recommend? One, I know you talk about, family support, meeting with a counselor, meeting with a medical professional if you want to go with cannabis, if they're combining drug to drug interaction, so for our listeners, this is, for informational purposes only. But don't
for
be afraid
myself,
to ask.
A regular physical.
Yeah.
I check in with my psychiatrist, every month to talk about medications, not necessarily for therapy. I see a therapist every couple of weeks. If I need her more, once a week. Licensed clinical social work. I have a support mechanism in place that if I get really low, I can go and call someone or see a friend if I can. I have, but the key thing is, I think it's making sure that you almost force yourself or have a motivator to get out and exercise and know what you're eating and how you're going to make plans to deal with stressors that come along, such as this. Remember, I couldn't deal with multiple tasks. So I have a conservator who handles my money and has a budget. She also pays my bills. I don't pay any bills because it was too much. When I left radiology, the pace got to me.
Yeah.
Having to see 30, 40 mammogram breast, and I loved what I did, mammogram, seeing patients, but that's what worn me down. So if I have to do 2 or 3 or 4 things during the day, that's what's going to get me revved up. So I get revved or irritable or revved, also to cause depression. And then, I'm not thinking that I'd like to be whole.
Well, I know it's past your bedtime.
No, this was very good sharing. I'm glad that I can share. Just remember to protect yourself with the money, protect yourself with having good doctors and therapy, and don't forget to bring in the team approach, making sure that you have cannabis expertise that may add to what you're taking from the other docs who won't understand the cannabis angle at all. But if you're not getting better, you have to do something. And this, you can start slowly, and you never know how your mood may improve, and whether that just be with CBD or whatever. This is just an alternative to consider, or it's a combination, adjunct is what we like to say. But if push comes to shove and your depression is not getting any better and you're suffering, or your mania, don't forget about electroshock therapy. And if
Nope.
you're suicidal, remember that. Remember what I just told you, okay? You're scared, you don't want to do it, and it'll help you. 80 to 90%. The other thing, if anybody is suicidal and they're really depressed, they now have ketamine clinics, ketamine infusion clinics. Ketamine used to be a horse tranquilizer, also used for pain in humans. Now it reverses depression and wipes away suicidal thinking. And they have different clinics in different cities around the country. And if you Google it, I've had multiple ketamine treatments. You go in, I went in like at 9 o'clock, came out at 10 o'clock, and somebody drove me home, but I wasn't anesthetized or wasn't anything. But all of my suicidal thoughts and my really depressive thoughts were wiped away.
Wow.
After an hour. The only problem with ketamine is it usually costs about $150 after infusion, per infusion after treatment, and it may only last 24 to 36, 48 hours.
When you say infusion, is it IV infusions?
IV. They also do nasal spray,
Yeah.
and they also do in the mouth.
Yeah.
I always think IV is the best way to get it in and have the effect. They do it by weight. And so if anybody is suffering, and they should at least investigate ketamine infusion, and they at least will have 24 to 48 hours of just pure bliss without being high.
You know, we had Brad Burge on here talking about psychedelics, and I know it's a topic that another stigma that people think. And you know, Crin and I were actually in Colorado, I want to say 9-10 years ago, and we knew Brad here from the San Francisco Bay Area. And you know, I said, "Oh, I didn't see you at the conference." He goes, "Oh, I was at another conference," and this is when he was with MAPS. And I said, "You guys," I was here for the psychedelic conference. I said, "Was it a rave?" He goes, "No, it was actually a psychedelic conference," and we talked about mushrooms and migraines. And I said, "Come on." And so I started doing all the research on that, and it's amazing what's happening. And I think Colorado has led the way for.
And now Oregon too.
Yeah, in this last.
In Oregon too. Election. Oh yeah, they're doing trials. I'd love to be in a trial. A lot of the trials are depression only, but I would love to use a microdose of psilocybin and see if it would help me with my depression.
Yeah. You ever use light therapy?
Yeah, I use light therapy now.
Yeah.
Especially with the shorter days.
Yeah. What is your opinion on psychedelics?
The research that I've read, it's all positive, or it's the hottest thing.
Yeah.
And the people who have done it, I've spoke to some people in hospice who did it, and they were very at peace when their minor trip was over, the experience was over, and guided, because they weren't afraid. It's like they saw the other side.
Yeah.
The people who used it with depression just came back and had a more lasting relief.
Yeah. You know, it's a lot of patients we've spoken to, a lot of doctors. I know you mentioned you had a ketamine treatment
infusion,
for your infusion for your bipolar. They're using MDMA, which I know is synthetic. Is ketamine? I know it's a horse tranquilizer originally. That is not synthetic. They have ibogaine. Ibogaine, I think, is to get off of addiction.
Yeah, I don't know. I think it would be synthetic. I think it would be any lidocaine, ketamine, or ketamine. But anyway, I don't know. but I
Yeah.
just know that it worked. It was spectacular and it worked, because when I went, I was feeling very depressed.
Yeah.
And I had a lot of suicidal ideation. Suicidal is thinking, but not acting. And so that's been 50% of my life as well. But when I went in for the ketamine, it was unbelievable.
Yeah.
A good experience.
So your health maintenance is a lot. This is a daily routine for you. And I know that like this with a lot of bipolar, do you like a regimen
Love structure.
structure?
The more structure, the better.
Yeah. Yeah.
The more structure, the better.
Yeah.
And that's what most bipolars and mentally ill people, like as well.
Do you paint it all?
Not yet. Not yet. I have to hard. It's sometimes hard for me to start
Yeah.
projects.
Yeah. You know what calms me? I love doing laundry. I love washing cars. Love washing dog. That to me just my bike that gets it just takes me away. And I know that helps with a lot of people going through depression, bipolar, anxiety, sleep issues. Staying busy. That's one thing. When Corinne's passing, you know I have kept busy nonstop, and I'm starting to get to the point where I can now relax. I can start reading again. I can start doing things where before my mind was just go, 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 go. And I don't want to say I was running, but that's what kept my mind balance is doing things. And I didn't know if that was something that you had a structure to.
Sure, I have a structure each day of what I do: the breakfast, the walk, all of those different things. Going to bed where I am. It's just that I'm still. It's just a hard case. I mean, it's just a difficult case, especially after I do a ketamine treatment or two, and I really walk out of it and I say, "Man, this is the way it must feel for normal people whose neurotransmitters are somewhat more balanced."
Yeah. Does cannabis help you with your neurotransmitters? I know you use THC.
Well, it helps me with it. Yeah, it balances it out. Just like THC is supposed to do, serotonin and dopamine and things like that.
Yeah.
So it gives me that extra boost to help me be the productive.
Yeah. Well,
So
Paul,
yes.
I can't thank you enough.
It's my pleasure.
There, and sending you a hug. I know. Like I said, it was past your bedtime, and we all need hugs. And,
That's true. That's true. And thank you for our friendship. And again, if people out there need somebody, a doctor who's been through it, they have the contact information through John. And I know this. Unfortunately, and I really know this.
Here's one that came through. This was excellent, John. Thank you. That man touches me. So that's what our listeners.
The highest compliment
that
I can get.
Yep. And so I thank you for that. And I thank you for our listeners. And I'm going to throw one more plug because I put a lot of, the team, the Green Plant Summit, if you want to go to the website, Green Plant Summit starts tomorrow, but put a lot of time and effort into this. And it was, I met 33 plus experts, interviewed all of them since June. And, we started off with 25. And we kept on meeting more and more and did 33, but that airs tomorrow. It's free. Go to the website. You can sign up there. But Paul, thank you as always. And
my pleasure.
Appreciate
you. Take care of yourself. All the best.
And how can people find you again?
My website is cannabisresource.info. Cannabisresource.info. You can Google me, Paul Bregman, Bregman. MD, Denver, Colorado, LinkedIn, all those things. But cannabisresource.info is where I am, or through John or anything like that.
Cool. When we did the podcast, I had people come and like, he looks so familiar. He looks like a movie star. I go, yeah, Stanley Tucci. You ever get that?
Sometimes.
I love you, Paul.
Brad Pitt too.
Oh, all right. I love it. Well, thank you, Brad Pitt. I appreciate you being on the show. And
all right, thank you very much.
And sleep well. And I'll talk to you later. And thanks again.
Thank you, audience. Take
Thank you,
care.
everyone, too.
Bye-bye.
Bye-bye. Bye.
Thanks, John.
Bye. Hey, everybody, John Malanka with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA, that's right, USDA certified organic hemp and CBD brands. And all of its hemp is grown from the perfect topography and climate found in Colorado. It is a family-owned business and is deeply committed to the science of providing only the purest hemp and CBD products for the best results and most beneficial experience. Its mission is to bring the therapeutic value of pure, organic hemp and CBD to people who seek supplemental relief through the use of healthy, natural products. Aspen Green is free from toxins and runs up to 8 different lab tests from bona fide third-party labs throughout its product line. It holds in high regard 3 foundational principles that guide every aspect of their business, actions, and interactions with their customers, partners, as well as their community. These are quality, integrity, and transparency. These will always remain at the hearts of their efforts to bring their beneficial products to consumers. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Again, UPGCBD for 20% off at aspengreen.com.